everyone, my name is Esther and I'll be presenting you with human immunity. Here are the topics we'll be covering in this section. We have the first and second lines of defense. We have the third line of defense, self-recognition and tolerance, and two specific immune disorders. We'll also be looking at immune response to vaccination, the concept of herd immunity, vaccination programs and benefits of vaccines. So let's dive into it. First, we'll be looking at infection. What is infection? According to White 2020, an infection refers to an invasion of the body by harmful microorganisms or parasites. The severity can range between mild or fatal. There are different causes of infection. And we know this to be bacteria, fungi, parasites, viruses. All of these causes have their own diseases that they can cause. For example, with parasites, it causes things like malaria. Viruses, we have things like influenza or hepatitis. While fungi cause things like skin disease, like eczema, etc. And bacteria, we have things like strep throat, cellulitis, etc. So this diagram just shows different types of infectious diseases. The first and second line of defense. What is the first and second line of defense? So the body, in order to defend us from these infections, has three lines of defense. So these lines of defense helps the body to be able to defend us from any bacteria, from any infection. So the first line of defense is the barrier in place that first prevents the pathogens from invading the body. This is the physical thing that we say, like the skin or mucus. For example, the skin would not let anything go through it. Any infection has to go pierce through the skin to be able to get into the body. And by so doing, if it's able to get through the skin, then it's gone past the first line of defense. The mucus as well, when you have cough, cold and flu, we try to get rid of this through mucus. Or if something gets into your eyes, we're able to clean it off. Sometimes by crying or by tearing up, the eyes is able to release those things. So the body's protective barrier between its internal environment from external invaders is the first line of defense. They line up the surfaces of the eye, ear, mouth, throat, respiratory tract, and many others. For example, the skin protects us against bacteria. But when the skin is torn open, the next line of defense comes in. So these two pictures shows us the first line of defense. Really, this is the skin, and then we have the mucosa. So here we're going to look at the second line of defense. What is the second line of defense? It's what the body does in order to tell us that it's trying to recover, is dealing with some infections, and we see it in manifestation in things like fever. When you have fever, or you have some swollen knee or swollen ankle, or some part of your body is swollen, this is the physical one we see, and this shows us that our body is trying to deal with something and is trying to to fight something. So for example, when you have fever, the body increases its temperature in order to stop bacteria from growing and making the immune system to work faster. Inflammation, swelling of the area of infection to increase the number of white blood cells on the site. Complement proteins, the body releases blood proteins that breaks down and removes the pathogen. Cytokines are small proteins inhibiting the production of the viruses. White phagocytes are large white blood cells that engulf foreign bodies. Inflammation, this is just a picture of what inflammation looks like and phagocytosis. So with inflammation, once the pin goes through your body, a chemical signal is sent to the body. The macrophages start coming to the area of infection. It engulfs the parasite or whatever infection, bacteria, whatever it is, and this way it's able to clear the infection. And this is the process of phagocytosis. Now we're looking at the third line of defense. What is the third line of defense? This is the body's internal defense against infection and pathogens. This occurs when the pathogen successfully navigates the first and second defense stages of defense, right? So it has to go through the body to cause fever and all that, and it still haven't gone. The third line of defense comes in. Microbes known as pathogens can infect the organism and lead to disease. These pathogens include things like viruses, bacteria, protozoa, fungus. So the third line of defense really includes the immune system. How does the immune system function? The immune system has different types. It has about main types of the immune system. They include neutrophil, lymphocyte, monocyte, eosinophil, and basophils. Neutrophil is the highest in number when it comes to the white blood cell. So we have about 40 to 60% of neutrophil in the body, which helps us to fight against infections. Lymphocytes, on the other hand, it has three types. We have the B cell, the B lymphocytes, and the T lymphocytes. And then we have the natural killers. The monocytes are the biggest in shape, and they mostly work as macrophages or dendritic cells. Eosinophil is particularly found somewhere especially in the gut, the GI system, where it helps us to fight against maybe things like uh, food poisoning and things like that. So basophils is the least, which is found about 0.5 or 1% in the blood. So yeah, that's the immune system. Now we're looking at the self-recognition and tolerance. How does the body recognize itself? Recognize self from non-self. So the body is able to recognize this through a numbering MC1, MCH1, and MCH2. Excuse me. They also the body recognizes this through antigens. Antigens are molecules that alert the body to a particular pathogen's presence. As a result, it triggers an immune response in which the immune system is instructed to either make an antibody or for that virus or develop immune resistance to it. Any substance, including proteins, carbohydrate, lipids, and nucleic acid, can act as an antigen. This molecule is required by the pathogen in order to enter the body. So, yeah, the viruses or infections cannot get into your body without this antigen because it needs an antenna, it needs a connection to be able to connect to the cell, whichever cell that it attacks, it wants to attack. And it needs a particular type of connection. Antigens' distinctive properties enable the immune system to differentiate between self and non-self, allowing only the non-self to be targeted. For instance, antigens produced by Staphylococcus differ greatly from those produced by the red blood cell. So it knows when to, okay, this is not mine, I'm attack. But in some cases, we have things like called the autoimmune disease, which actually sadly causes the cells to attack its own cell, the immune system to attack its own cell. So pathogens from different types of antigens, which tells it when a specific virus enters the body. These are different ways that the body responds to self recognition or tolerance. This is the way they respond through sensitivity, hypersensitivity, rejection of transplanted organs, or autoimmunity. Let's look at these three. The first, sensitivity. The body's immune system is like an army that is constantly on guard and prepared to combat any intruders, hence why it is sensitive. Hypersensitivity is an abnormal pathogenic immune response triggered by repeated exposure to the same antigen. For example, can be allergy or your autoimmune disorders. Rejection of transplanted organs. This is where the body just rejects. It just can't cope with an organ that's been transplanted into it. Maybe because the blood is not, components are not well married or whatever. So it can reject a transplant by being hyperacute or through acute or chronic rejection. So hyperacute would mean that there's a need for an immediate removal of that organ. Otherwise, the patient would die or the person would die. Acute might occur after 3 weeks to months, whilst chronic rejection can take up to years in order to surface. So now we look at autoimmune disease. What are autoimmune diseases? Autoimmune disease is a type of disorder where the immune system attacks its own cells. Some autoimmune disease includes Crohn's disease, rheumatoid arthritis, type 1 diabetes, multiple sclerosis, and many more. The diagram on the side just shows us different types of autoimmune disease. For the sake of this presentation, we'll be looking at Crohn's disease and type 1 diabetes. Now, this is Crohn's disease. Crohn's disease is a disease that affects the GI system, the gastrointestinal system tissue. So it actually literally attacks every part of it, but mostly focuses on we found that we have more of these attacks in the colon and the small intestine. So what is this Crohn's disease? Crohn's disease is an inflammatory autoimmune disease that affects the GI system, like I mentioned, mostly attacks the small and large intestines. There are no known treatments of yet. However, in most cases, surgery is recommended. Symptoms may include diarrhea, bloody stool, stomach cramps, feeling the need to go toilet every time, even after going to the toilet you feel like you want to go back again, fever, etc. Causes are not known yet. There are no known yet causes. Studies have shown that one's immune system and genes or environment can play a vital role in the development of this disease. Diagnosis: how can this be diagnosed? This is done after a series of tests, stool test, endoscopy, colonoscopy, CT scan, MRI scan. The doctors do this in order to know the depth or the location of this disease. Now we'll be looking at type 1 diabetes. What is type 1 diabetes? It's also an autoimmune disease. This picture here shows us like the symptoms, the symptoms of the disease: frequent urination, excessive thirst, extreme hunger, extreme fatigue, blurred vision, sudden weight loss, irritability. So these are some of the symptoms of type 1 diabetes. Now let's look at it. What is type 1 diabetes? A type of autoimmune disease where insulin producing cells are attacked and destroyed by the body's immune system. Symptoms include blurred vision, mood swings, frequent urination, increased thirst, intense hunger, unexplained weight loss, etc. So many others. Causes is not known yet. However, it's been found that this can be linked to genetic issues or problems with your pancreas. Diagnosis: how can this be diagnosed? The doctors try to diagnose this through glycated hemoglobin test. So this test shows about the average measure of your blood sugar for the past 2 to 3 months. Also, you can check this by fasting blood sugar test or random blood sugar test, just to determine how high your blood sugar is. And the treatment, doctors mostly treat this through prescribing insulin and also advising you to look at lifestyle changes. Acquired immunity. What is an acquired immunity? As discussed earlier, our immune system are completely unharmed at birth. So we have no idea, we have no memory, the immune system have not done anything yet. So it's reliant on acquiring some immunity. How we acquire this: sometimes babies receive it mostly through our mothers, through the placenta exchange of nutrition, or we get this through passively whilst in the stomach. But also we also get this when we are born, natural passive immunity. We just receive this through breast milks, and also through exposure to an infection or to a disease. We also can get this acquired immunity through vaccination or immunization. This picture shows different how the different types of immunity: passive, natural, acquired immunity. We also have a passive artificial acquired immunity. The passive natural acquired immunity is through breast milk. Artificial is through immunization. The active one is through exposure to the disease, and the artificial active one is through vaccination. Now we're going to look at vaccination, how the body responds to the vaccine, how our immune system responds to vaccine. Vaccination is the process where the immune system is exposed to a less harmful version of a particular pathogen. During vaccination, this is mostly done. Vaccination is mostly done through injection or some intravascular something. When encountered by the immune system, the body releases antibodies in order to fight the disease. It learns to build antibodies and release it, make memory for that disease. Vaccines can be administered as live or inactive. Okay, an active vaccine or live vaccine are made from bacteria, viruses that have undergone laboratory training. So your body starts preventing the disease immediately. Inactive vaccines, however, are the type of vaccines that you have to take over and over again. Like some example would be hepatitis. You have to take the first 3 months, you come back for the second dose, and some others have 3 doses in order for the vaccine to be active. Concepts of herd immunity. What is herd immunity? Herd immunity is a type of immunity where the community or a large population is resistant to the spread of an infectious disease. Depending on the severity of the disease and its transmission, the concept of herd immunity is to have large number of the population immune to that disease so as to protect the vulnerable groups, which includes the children, the elderly, the expectant mothers, and the sick, to protect people who can be vaccinated against those diseases. So the herd immunity is whereby the community are encouraged to take vaccines in order to limit the spread of the disease. Herd immunity also can, this is a picture which shows a typical example of a herd immunity, how the population or the community is able to protect themselves against an invading virus or epidemic. So here we have only one person, and this disease is very infectious. We only have 5 people who are immune or vaccinated against this disease. Then before you know it, this person with this highly contagious disease can spread it to the whole community, except these 5 people that have been vaccinated. However, in a community where everyone or most people, majority of the people are vaccinated, they are able to protect themselves and protect the vulnerable ones from the spread of the disease. Benefits of vaccines. Here we're looking at why are vaccines beneficial. We know that the vaccines have saved our world from a lot of damages, from a lot of epidemic, ranging from chickenpox to the Ebola part to the COVID-19, a lot of things. And we know that when people are vaccinated against those diseases, and we know that vaccines are that bacteria or virus that have gone through a lot of thinning in the laboratory. It helps the body to build a memory ahead of time in order to combat those diseases when they're exposed to it the second time. So vaccination is very important. However, we have factors that can affect people taking vaccine. Factors such as maybe they are sick, or there is a threat attached to those vaccines. For example, when the COVID-19 came out, people were talking about how it can prevent young people from having babies, and this sent a lot of young people into panic. But fortunately, through positive reassurance, people were able to get back on it. And sometimes it might be religious beliefs or things like that that can prevent people from taking vaccines. However, vaccines have proven to be very, very beneficial to our society. Here we have a picture showing the statistics of vaccine and how it's helped to eradicate diseases. And then on the side we have a picture of the children or of the threats that people feel before taking vaccine. However, through valuable social communication or credible sites, we're able to build up people's beliefs and participants in helping to save the society. Thank you for watching.